Hi, I'm Fred Kowal, President of United University Professions. Today, I would like to speak to you about the situation facing our health sciences centers and hospitals in SUNY as a result of the governor's proposals this fiscal year. You need to understand a couple of things about the SUNY hospitals and health sciences centers. They are by far our largest institutions in terms of faculty, staff, research going on, but then also the important tasks of healing those who are sick and in many cases could not get health care anywhere else. Having said that, what the governor has proposed each and every year that he's been in office has been to radically cut the state subsidy to our hospitals. When he became governor, the state was contributing $128 million per year to the hospitals. Now, this is absolutely necessary because of the fine work the hospitals do in treating those who cannot afford to pay or are on Medicaid, and therefore the federal government is not compensating the hospitals as much as they had in the past. The other important thing to remember is that our hospitals in SUNY are unique state institutions. They have to pay all of the benefits that come with negotiated contracts for all of the bargaining units whose members work at the SUNY hospitals. This is a huge expense. The state doesn't pay that portion of it. The hospitals have to generate it themselves. Therefore, it is imperative that we get as much of the state subsidy the hospitals need. The governor has proposed to cut out everything that the Assembly and the Senate added last year to the subsidy. It was at $88 million, give or take. The governor has cut it back to just under $70 million. We need to get that subsidy to where it has to be for these hospitals to survive and flourish. Second, the governor has also proposed a radical concept that in fact is also not new. He's proposed it a few times now. What it would allow is for private investors to come in and run these hospitals. It's imperative that you understand what has happened in Massachusetts, in Connecticut, and in New Jersey, where private equity has come in to public hospitals. They have run these institutions into the ground. The fourth largest city in Massachusetts, Quincy, Massachusetts, is now without a hospital because private equity came in, they bled the hospital dry, and then they left. The hospital has been forced to close. These are the things that happen when private equity comes in seeking profits. They bleed the hospital dry, and then they leave, and the hospital cannot survive. We can't let that happen to any of our SUNY hospitals. So we have to stop any proposals to bring in private equity, private investment of that type. Third, we need to understand that when the governor proposed, as he did, to spend $700 million in Kings County, which is Brooklyn, to remodel, to change healthcare delivery, there's a major problem with this proposal. On the surface, it looks great. But you read between the lines, and actually you read the language itself, and that's where you start to see the problems. What the governor is proposing is that the legislature give the Commissioner of Health, one person, total control over how that money is spent. Now, for all intent and purposes, that means the governor is going to be deciding where that money goes. No one in Brooklyn, indeed, no one in New York State, other than the Commissioner of Health and the governor, are going to be deciding how and where that money is spent. There will be no input from people in Brooklyn. There will be no input from legislators from Brooklyn or anywhere else. There will be no input from those of us who represent the fine working people in the hospitals in Brooklyn. It will be all left to the governor. In this day and age, where there's so much concern about corruption in government, about how money is allocated, what we need is an open process so everyone can take part, and money that is intended for Brooklyn is used in a fashion to ensure the best medical care for everyone, while also preserving and protecting our incredibly good, our showcase hospital and medical school in Brooklyn at Downstate. For all these reasons, it's imperative that every UUP member take part in our outreach activities. Without you, we can't get what we need. Protection from these dangers to us, but also a proper investment in our public university. I want to thank you for the work that you're doing and invite you to join us to work on behalf of our university during this legislative session.